I was a staff nurse and started seeing some of the issues at Stafford Hospital that I was a little bit worried about. Lack of basic equipment such as blankets and pillows, poor staffing, both nursing and medical, some of the unprofessional behaviour, conduct, the way some staff were treating patients, and also the way colleagues were treating each other as well, because there was a real lack of care and compassion, not just for patients actually, but for each other.
When I was working in a social care organisation, a colleague of mine who I'd worked with for a few years did something that was totally against the rules of governance at the time. What had happened was a breach of confidentiality on quite a large scale with regard to patient data. The health and safety and certainly the confidentiality of hundreds of children and vulnerable service users was now in the hands of people who had no right to have that information. Even then, I knew doing nothing wasn't an option.
Nearly 20 years ago, in my first year, I worked with a surgeon about whom I developed a number of concerns in regard to his performance and conduct, both of which I felt were putting patients at risk whilst he was operating. It was difficult for me at home the day before I worked with this particular surgeon because I would be worried about what was going to happen to the patients next day. I had to make allowance for the fact that there was likely to be an awful lot more blood loss. A lot of my patients would end up requiring intensive care following surgery with this particular surgeon, so I had to make sure that there was provision post-operatively for a patient to go to intensive care if they needed to. I had to have blood and blood products readily available to me for his patients in a way that I wouldn't with other surgeons.
Clearly seeing patients suffering as I did was just so distressing, because that's not what I came into nursing for. You know, nursing is a vocation. It's a profession, but it's a vocation. A lot of the quite senior staff were being bullied as well through the management structure, and this led to them starting to falsify records. There was a real threat that the department may be downgraded if we didn't meet our target, and basically we were told and instructed to lie about it. Along with many other staff, tried to raise this through the usual routes, but it soon became quite clear that it was just being ignored and the situation got a lot worse.
I had raised issues before about some of the things that my colleague was doing, but those things had never been dealt with, never been taken seriously, never been investigated. So on this occasion, because it was such a serious breach, I felt I had no option other than to raise it outside my own line management structure. The thought of what would happen to me, quite selfishly, as a result of what felt like a betrayal of not only my colleague but of my line manager was quite terrifying. I made disclosure to a colleague. He was a senior manager in another part of the organisation. He agreed with me that it was, in his opinion, you know, one of the worst breaches that he'd ever come across, and he arranged for me to make disclosure to the head of service directly.
Eventually I had what I felt was a significant volume of concerns and notes, and they were across a whole range of different aspects of both the surgeon's performance as a clinician but also his conduct, the way he behaved. I somehow felt I was being a bit disloyal, but ultimately the issue wasn't about me and the issue wasn't about the surgeon. The issue was about patient safety, and so the trust started an internal review of the surgeon's practices.
It was a very, very difficult thing to do, and it was something that was quite frightening and weighed very heavily. I don't think I ate or slept for days around this. In the end, I felt that my duty of care to those people who were vulnerable was more important than any feelings that I had around what would happen to me.
I took my concerns to more senior management, wrote more formal reports, and ultimately there were some investigations and 2 of the nurses were suspended. There seemed to be a bit of a cover-up, and the 2 nurses who had been suspended temporarily were reinstated into the department, and things just got worse really from there on in. Myself and colleagues who supported me were bullied, threatened, intimidated.
After I'd raised my concerns, I had to continue to work in the job. I had to do the day job, and I had to be line managed by the person who was now under investigation as part of her handling of the previous incidents that I'd raised. She wouldn't speak to me unless there was a witness present.
There was a significant proportion of the consultant body that ostracised me and kept me distant I was aware when I was in a room that people were talking about me but not with me.
The threats consisted of being told that people knew where I lived. I was warned about walking to my car at night after a late shift.
I felt that there was now a sense of mistrust around me, that I was someone not to be trusted.
On a number of occasions I was verbally attacked, challenged and humiliated.
People had heard they were scheming, that they were going to make it look as if I'd made a drug error, so it was very intimidating and frightening going on shift every day.
For the whole period of the ensuing investigation, it remained a lonely place to be, full of anxiety and full of fear.
The only thing I could do was try to behave appropriately in those situations and not rise to what I saw was being baited, really. After I had said I was no longer willing to work with the surgeon, the rest of the department agreed and did the same until the surgical review was completed, which was a great show of solidarity, but also indicated that the concerns weren't actually just mine.
I was lucky enough to actually move to a promotion in a neighbouring trust, but I was still very concerned about the patients and my colleagues who were left behind. So I started to contact local MPs, local campaign groups who I know also were raising concerns.
The surgeon was actually suspended by the hospital, and more people started to come forward with concerns as it became more widely known that he was being investigated.
The MPs used some of my evidence to quote in Parliament, and ultimately we ended up with the Francis inquiries, and I was asked to give evidence at both the independent and then later at the public inquiry.
The police charged him with the manslaughter of 3 patients. He went on trial at the Old Bailey, and in September 2004 he pleaded guilty. After that he went back to the GMC for a further hearing, where he was erased in December 2005. From a personal point of view, I felt a lot more secure and reassured that my actions had been justified.
The care of vulnerable people and children was entrusted upon me and others, and I think for me not to have done anything would have been a betrayal of that trust. And when I look back on it, I am absolutely certain that I avoided harm to those children and vulnerable people.
Ultimately, we ended up with an NMC fitness to practice hearing as well, involving the 2 nurses, and I was asked to bear witness at that, and the 2 nurses were actually both struck off the register, which was very sad actually. It's sad that it had to come to that, but I think it also gave a good message really that those kind of behaviours will not be tolerated. Throughout all that experience, it became very clear to me just how difficult it is for people to speak up and how unsupported they are when they do, and also how intimidating it is and how vulnerable you are. So through that I developed the Ambassador for Cultural Change role, which is essentially a Freedom Speak Up Guardian.
As Freedom Speak Up Guardian, I have the privilege of supporting colleagues throughout the Trust who want to raise concerns.
I can have concerns raised with me by individuals. They might ring me, they might send me an email, they might say, I want to come and see you.
The first thing I always ask somebody is, who have you already told this concern to? And 9 times out of 10, they've always already reported it some way. If they haven't, I will encourage them to go to their line manager or to another relevant person. But if that's not appropriate, or if they have already done that and they feel that they're not getting a sensible response, then I can meet them, take some detailed information of what the concern is, and then between us we'll decide what to do with it.
Some people use you as a sounding board but don't want you to take it any further, but I have to make them aware that actually if there is a patient safety risk, that I have to escalate it.
Your confidentiality will be assured. I think a lot of people, when they speak out, want to be anonymous, and that's an awful lot more difficult. Some concerns that are raised, it is impossible to investigate and keep someone anonymous. And anonymity is not what it's about. No one should feel, if they have a legitimate concern, that they need to be anonymous for fear of consequences, because they're going to be supported by a Freedom to Speak Up Guardian, preventing any bullying and harassment and victimisation.
My role is very, very clear that I'm not part of that investigating team. I'm just there to support the colleague to to ensure that the process is followed.
Whilst the organisation will employ the individual Freedom to Speak Up guardian, they still do have a responsibility to act independently of the trust, and they will have an accountability to take concerns outside of the organisation if necessary. Hopefully that won't be necessary and the concerns will be listened to and resolved and responded to appropriately within an organisation. That's what we all hope. I appreciate how difficult it is. People can feel very daunted and intimidated. They feel it's career limiting, they feel that the impact on them both personally and professionally will be huge. It won't be.
You should raise a concern when you first have it, and then it can be investigated and dealt with before it becomes enormous.
When we look back at mid-staffs, the small things were the things that became big things. So we mustn't brush them under the carpet. We must be really clear that those small things are really, really important. If you are one voice and you are concerned that something isn't right and you feel that your voice isn't enough, come and speak to me.
When you do start speaking out, lots of people start coming forward and supporting you, and people who you didn't think would, or who you didn't necessarily think had problems or concerns, and suddenly it just takes one person to be brave and step forward and others will follow. It isn't about getting people into trouble, it isn't about causing problems, it's actually about finding solutions and resolutions and helping prevent further harm or problems in the future. And if it's transpired that actually your concern was not as bad as you thought, or things have been investigated and it's been resolved, that's great, but you need that feedback as well. Clearly, if there is more to it, you want to know what's happened, you want to know that things have been put right as a result, and what the learning is.
That's one of the other parts of this culture, is it's about learning, and there is no such thing as a wasted investigation. Any investigation will always pick up things that you can change and improve. Raising concerns really shouldn't require its own agenda. Raising concerns should be part of how we work.
The more we push, the more we support each other, the more transparency there is, then the idea of speaking out will become more normalised. Culture change does take a long time, but you've got to start somewhere, and I think these guardian roles are a very good place to start.
Organisations are embracing this and do see this as a positive step and something that can help.
I remember when I was giving evidence at the public inquiry, Sir Robert actually asked me, you know, why did I speak up, and was it because of my awareness of my professional duty? And I actually said as my evidence, well, of course I was aware that I had a professional duty to speak up as a registered nurse, but it was much more than that. It was a moral duty, and it was my moral code that was telling me that you can't let patients suffer, you can't see colleagues suffer and simply walk by and do nothing.